Hey guys, Katherine Diggs here, nurse practitioner with the Entera Clinic. And I just wanted to come on today and talk to you guys a little bit about your thyroid health. I don't think we've ever done a video over thyroid, but it is literally one of the most important glands in our body. It is a tiny little gland that sits here and it's like the shape of a butterfly. Everybody has one. And the gland is responsible for so many of our very important hormones that help control our metabolism, our temperature, appetite, mood, energy, so many things, nervous system, cardiovascular system. I could go on and on and on about how important thyroid hormones are in literally every aspect of our body. It's extremely important to at least once a year have your thyroid tested. Some of the most common tests that we can do is just a blood test called your TSH, or thyroid stimulating hormone. And that gives us a little bit of information. But ideally, the goal is that you see an expert, and thankfully everybody that is a provider at the Entera Clinic are well trained and well studied in the role and the art of truly good thyroid health. We like to look at your active thyroid molecules, your T3 and your T4, and we also screen people as needed for different thyroid antibody dysfunction, such as Hashimoto's or some other a little bit more rare and challenging to treat and screen diagnoses. It's very important to screen for those things because we need to determine whether or not you have healthy thyroid status, or if you have underactive thyroid with a condition called hypothyroid, which is one of the most common metabolic conditions in women. If you have low thyroid, you're going to have extremely slow metabolism. You're going to feel tired all the time. You're going to be probably a little cranky. You're going to be cold. You're going to gain weight extremely easily, and oftentimes feel a little bit depressed. So it's very important that we find out, the status of your thyroid, make sure that it's not low. Then there's hyperthyroid. Some people are a little bit less familiar with this one, but some people with hyperthyroid feel extremely anxious. Sometimes they'll have a growth around their thyroid called a goiter or a thyroid nodule, and they just feel sometimes heart palpitations or heart racing, and it too can be very detrimental to your overall health. And so again, at least once a year, we want to tackle this and work you up for it. And if you have thyroid disease and dysfunction, hopefully you're going in and getting monitored, every few months to make sure that we have you on the right medication to either replace it or suppress it, whatever your need is. And so don't forget to come see us at the Entera Clinic when we can address a lot of hormone needs, but we will definitely do a deep dive on your thyroid. So come see us again in Lufkin, or we can do teleconnect. Call the office at 936-634-1400 and speak with Maggie to schedule an appointment soon. Bye, guys.